Over the years, we have watched Nikki Haley rise from becoming governor of South Carolina, the ambassador to the UN, a member of the presidential cabinet, and now as a candidate for president of the United States. I consider Nikki Haley to be a beautiful woman. All of the presidential candidates are always looked at under a microscope when they're running. The question is, did Nikki have any cosmetic enhancements to improve her appearance? So here we see the first image of Nikki Haley as a teenager, and we can see that she has a full oval-shaped face, full cheeks, her lips are thin, her brows are low, and we're going to see how her features evolve as she ages over the next few decades. So when we look at Nikki's photograph as a young governor, we can see that she has good symmetry of her face. She has an overall oval outline of her face. She has good symmetry and the distribution between her brow and her hairline, from her brow to her lower part of her nose, and from the nose to the chin are equally spaced, and horizontally across her face, there's good symmetry as well. What really jumps out at me, if she came to me as a patient, I would have said to her, however, your brow contour is not feminine. What do we consider a feminine contour? We consider some arching of the brow to be a little feminine. Whereas if it's horizontally across, like a T-shaped, that's more of a masculine contour that we associate with men. So her brow is relatively low. It's been low since she's a teenager, and it hasn't changed. However, as she ages, this downward descent of her brow is going to sandwich the skin from her eyebrow down to her eyelashes. It's going to encroach on her vision, and over time, she's going to find that her visual field is impacted by the downward descent of her brow. At this juncture, however, she's not done anything to change that image. A side picture of her, however, shows that she has a little bit of a dorsal hump to her nose. She has a good jawline definition. She has a nice smile. She has some crow's feet that are obvious, and those things can be also addressed surgically, but she has chosen not to do that. Now, at this juncture, the question may arise, why hasn't she done anything? Well, that's obviously a personal choice, number one, and I respect that personal choice. But the other issue is, of course, she wants to look authentic. And politicians want to look authentic. They don't want to look phony to the public at large. So they are a little concerned about having cosmetic procedures done, because that may project a lack of sincerity, a lack of messaging to the public, and therefore they're very hesitant, I believe, to have any cosmetic interventions, even though they may want them themselves. One sign that clearly shows she has not had any Botox around her face is that you can see the horizontal lines in her forehead are very deep when she frowns. She does have 11s between her brow. She has crow's feet in the corners of her eyes. These all indicate that she has not had any Botox injections at all. From a side view, you can see that she has some irregularity on the surface of her skin. It's probably old acne scars that have not been addressed. She covers it up with makeup. Of course, these acne scars could be treated with microneedling, with radiofrequency. It could be, you can get micro Botox injections, you can get fillers to fill in scars, and sometimes laser resurfacing. All those things can be utilized to improve the tone and texture of your skin, improve acne scars. In addition, very interestingly, she has some signs of melasma. Melasma is a dyspigmentation of the skin which occurs very commonly in Southeast Asian women in particular. It's common throughout the world, of course, but in Southeast Asian women, it's even more common. And that pigmentation is sometimes difficult to treat. There are many treatments for it, and if you want to know more about that subject, you can refer to my podcast on melasma. But in terms of her condition, she could have treatments for that other than using a topical medication or topical cosmetics. So Nikki could have improvement of her nose with a nose job or rhinoplasty by reducing the dorsal nasal hump and possibly correcting the nasal tip with either a nasal tip graft or a rotation of her nasal tip, which is done surgically, of course. So as she ages, Nikki Haley's neck has changed. It changed from a smooth contour where the platysmal muscles were smooth and there was no wrinkling, and now we can see on profile from this photograph there's some laxity of the platysmal muscles here and banding that is going on her neck. So these bands can be corrected either with local injections of Botox, which can help soften some of those bands, or if she's so inclined, she would have a facelift to not only correct the bands and the deep neck, but also change the jawline contour, because she's starting to develop some gelling along her jawline. And that can change the contour by lifting her face upward and tightening the muscles on her neck. So we have gone through the evolution of Nikki Haley's appearance from teenage years to the present. She's a beautiful woman. She's apparently very confident in her own skin, and she doesn't at this juncture feel any need or pressure to do any procedures to enhance her appearance. We're just going through the theoretical possibilities of what could be done. Of course, she's happy with who she is and is confident as a presidential candidate that her appearance will not interfere with her success. I hope you enjoyed this facial analysis, and I'm going to continue to analyze other celebrities, and we'll have fun looking at everybody's face and deciding what could be done to make them look even better.